Much. Now, tell me about your symptoms before the surgery.
The symptoms before my surgery, I had quite a bit of lower back pain and all the way down through the legs. And as the day progressed, it was to where after 5 minutes I had a hard time standing because the pain was so bad, and the same thing with sitting. So
That
the pain
we called
was,
it.
yeah. So it was 6 or 7 a good portion of the day.
We call that claudication, what you just described. So you had a spinal claudication. And how long before the surgery did you have the symptoms, and how was beside that your life?
I had the symptoms probably for a good 6 or 7 years. It just progressively got worse because I've been working for the last 20 years on my feet.
Okay.
And so that just kind of progressively made
Got
it
worse,
worse.
yeah.
So.
And so we did go through the diagnostic, we did conservative management,
Right.
and then we decided it's time to do the surgery.
Right.
When was that surgery?
That surgery was the 3rd of October.
So about 4 months ago.
Yes.
And now the pain that you had in the legs and the pain that you had in the back, how is it now?
About a 2.
Okay. So and walking and
Walking is much better. Sitting and standing, I've been able to sit longer and stand longer without having the issues with the pain, and I'm not getting the numbness down my legs like I used to.
okay, would you say you're back to your previous life before you had the back problem?
Not
yet?
quite, but pretty close.
Pretty close.
Yeah.
No, but that's I think what's something you told me something amazing about. First of all, I remember that surgery. Our surgery was about less than 40 minutes.
Right. It was very short, and
Yeah.
blood loss was 50 cc's,
Yeah,
which
very
was
little.
pretty good. And then
Very
I was up walking within the first hour. I was eating.
What did you notice? In the first day or two.
Actually, it was obviously the medications in the back
Yeah.
was helpful, but that was allowing me to get up and walk. But I was, even then, the pain wasn't nearly as bad as it was prior to the surgery.
Specifically, the leg pain. Did you notice the leg pain going away, or?
I noticed the leg pain going away. In the beginning, there was some numbness of the leg, so I had a little bit of foot drop at first that I had to deal with.
We talked about
Yeah.
that risk of nerve root irritation that we discussed with everybody about that. And usually it went for a few days. It gets worse when swelling of the surgery get worse, and then it starts getting better. How's your foot now?
Foot is really good.
Good.
Foot is really good.
Excellent.
And one of the issues prior to the surgery was if I would stretch funny or pinch, I would lose feeling in one of my legs and fall. And I have not had anything like that since the surgery.
So how long did you stay in the hospital?
I was in the hospital. I went home the very next day.
Okay,
I was
so-
out of surgery, I think, by 3 in the afternoon, and I was home or leaving the hospital at 10 in the morning.
So okay, less than a day actually.
Yeah, less than a day.
But you told me as well something about going back to work.
Yeah,
Tell me.
I went, had surgery on a Wednesday, and I was back to work the following Monday.
Obviously, that is you have a work that you can control your work.
Right.
And it's not like you have to do things that you're the only person to do.
Right.
But that by itself, being able to go back to work within few days, that is by itself very amazing. You have a fantastic healing, and I see today, just few months after the surgery, actually the bone is growing. Bone is growing in the back, and I see good sign of bone as well growing inside of the cage, and as well outside of the cage is start to grow. So few months after the surgery, bone is starting to grow. Everything is where it needs to be, and I'm pretty happy with the results. But you have an interesting job. Tell me about your job.
I'm a nursing home administrator, but I'm not one that likes to sit behind his desk.
Yes.
And
You
so
wanna
I'm
mix.
I'm out and about quite a bit, and
Okay.
we've had several residents coming through now that have had the same type of surgery, and
But have you had as well patient who had different kind of surgery?
and we've had some that have different kinds of surgeries too.
What do you see as a different?
Recovery time and pain.
Yeah.
Is usually the biggest difference between the two of them.
And that is after they come to you.
Right.
Because by the time, first of all, not only our patient go home sooner or go, if they need to go to nursing home, they go there sooner.
Right.
But as well, before they go, the time between the surgery and the time they are ready to go home or come to you, after open surgery, it's much more with problems.
I would give you an estimate of probably anywhere from 25 to 30 days difference.
In the house, your place.
There was one individual that had 4 different discs that were worked on, and he stayed in the facility for 2.5 weeks and was able to go home.
Okay, but the length they need to stay there, but as well, in the hospital as well, people with the open surgery, they have more ileus, obstruction of the bowel, or they have more blood loss. They need blood transfusion. It just, but even in that time frame, there's a huge difference. But when they make it to get the criteria or reach to come to you, it seems still they benefit if they have less trauma to the spine.
Absolutely, because pain is the biggest factor, and with conventional surgery, I'm seeing that the pain level is a lot higher, so they aren't able to manage as much of the rehab as far as time-wise, and that's why you have the extended stays.
So they can work better with rehab, is your observation.
Right.
Well, this has been very helpful testimonial. Thank you so much.
I appreciate it. Thank you.
Okay.